Welcome to Guilford County's EMS Rider Observer Program. My name is Ashley Dunn, and I'm the coordinator for this program, and I've worked directly with each of you to get you scheduled for your upcoming observations. Today's presentation is to give you some general information about us, as well as give you guidelines and helpful tips about ways to prepare for your upcoming experience with us. So if you're riding here as an observer in our Rider Observer program, it is observation only, meaning that you are not expected to complete any clinical assessments, do any clinical skills, nor should you be delivering any patient care while you're here as an observer. We have many different groups that come and participate in our program. So you may be here from a local hospital as a new emergency room nurse or pharmacist. You may be here from a local educational institution, such as an athletic training program or a nursing program. We also have people from our community that you may be here and have never stepped foot in an ambulance ever a day in your life, but you're here to learn more about EMS as a career and what we do from a pre-hospital setting. You also may be here as an applicant in our hiring process. We highly encourage people that are looking to work with us to come, do a few ride-alongs, talk to our current employees, ask questions, see how we manage our system, see how many calls run in a day, and really ask yourself, is Guilford County EMS the right place for you? No matter where you're from or why you're here, just know Guilford County EMS is very excited to have you with us, and we welcome you. We hope that you enjoy your time with us, and we look to see you here again very soon. So what can you expect from us? If you come in for an observation, what can you expect during that observation time? So here in Guilford County, we respond to only 911 calls in the EMS dispatch system. Of the 530,000 people that we have that reside in Guilford County, if they call 911, then EMS is going to be responsible for providing the emergency medical response. We're responsible for about 658 square miles of territory, meaning Greensboro, High Point, and all of the small towns and cities in between. In 2021, we had about 93,000 calls come in for medical need. It's about 250 calls a day. So we're quite a busy service. Every day is different, so you never know what you're going to get. Who are you going to be paired with when you come in for your observation? And who works on an ambulance? So there are 3 certification levels of providers that work with us in EMS. We're all titled emergency medical technicians. However, your entry level emergency medical technician used to be called EMT basic. That is your entry level EMS medical provider. Your highest trained pre-hospital medical provider is a paramedic. This is the person that is going to be leading your calls and leading your crew throughout the day. You also may have an AEMT on your truck. So we have paramedic, AEMT, or EMT. There are going to be 2 people on the unit that you're paired with. You're going to have a paramedic and maybe another paramedic, a paramedic and an EMT, or a paramedic and an AEMT. Either way, it'll definitely be 2 people, and you'll be with them for the entire shift. Some things to think about before you come in for your observation. We're going to ask you to prepare and pack any lunch and snacks that you may need for the day. We want to make sure you're well hydrated as well as well nourished throughout the day with us. That also includes packing any necessary medical needs, such as medications. Pack them in like a lunchbox or in a book bag, and keep in mind that we have very limited space. Our office on wheels does not have a lot of storage. We have a lot of things on this unit with us, so we ask for you to pack lightly, however, pack exactly what you need, and bring it with you when you get on the truck for your shift for that day. Before you come in, review the observation email that I send you. It has a lot of pertinent and very valuable information in it, including your arrival time. Your arrival time is going to be different from your shift start time. This gap in time will give you time to come in, meet your crew that you're working with for the day. It'll allow you to complete a rapid COVID screening to make sure you're not COVID-19 positive. It's also going to allow you to ask any questions before that first 911 call comes in. That email also includes names of the people that you're going to be paired with for the day, as well as building access and parking instructions. Every EMS base is secured and it has to have batch access for entry. So this information in this email will help you be able to locate the correct entrances to be able to locate the personnel that you're going to be paired with for the day. I do ask for you to review those attire guidelines in that DocuSign packet that I sent you. But really quick, it's going to touch on some important takeaways to think about as you prepare about what you want to wear. If you have medical scrubs, feel free to wear those, or if you have an assigned uniform from your agency or from your curriculum program, you're more than welcome to wear that. If you don't have either of those, wearing khaki or dark colored pants and also a collared or a polo style shirt, those are going to be acceptable. However, casual jeans, short skirts, dresses, sleeveless tank tops, anything that has offensive writing, we're going to ask for you to leave those at home. Also, leave at home any excessive jewelry, those really strong perfumes and colognes, make sure you leave those at home as well. Check the weather before you come because we do want you to bring any weather appropriate accessories if needed, like a rain jacket, hat, gloves, sunglasses, things that are going to help you remain comfortable as we're going to our emergencies. We can be inside, outside for an extended period of time, so we want to make sure that you're comfortable and able to accommodate what's needed during those EMS calls. So during your observation, when you first arrive, so you're going to complete a rapid COVID screening. Every EMS base has a COVID testing area. We're going to ask for you to come in and complete a test when you first arrive. After that test, if it is positive, you are going to be asked to go home, contact me, and we can get you scheduled once you test negative. If you are negative, we are going to hand you now a PPE kit, a personal protective equipment kit. It's going to include things that will protect you throughout the day. It'll be a KN95 face mask in there. We're going to ask for you to wear that your entire time that you're with us. Also, there is a gown to protect your clothing in the event that you have it called that is needed, as well as an observer traffic vest. It is a yellow vest that is highly visible, and it makes you highly visible anytime that you are responding to a call in a roadway or a hazardous environment. So please make sure just to follow the communication and the guidelines from your paramedic and EMT. They are going to guide you and let you know what you should and should not do during your time with us. Maintain communication with them throughout your shift. Each paramedic and EMT has a radio that they use and have with them at all times. Our emergency calls as well as standby requests come in through those radios. If you're not with them when that call comes in or that request is sent in to them, it will result in us having a delay in response, which is something that we do not want at all. We should be en route to any emergency call or any standby request within 60 seconds of receiving it. So just make sure that you let your people know where you're going to go, where you're at in the base or anything. Just maintain that communication throughout the shift just to make sure that when something comes in, we're able to locate you and we're able to quickly respond. Also, keep that email that I sent you handy at all times. Any EMS personnel may ask you for proof of observation. This is for your safety and ours, and if at any time you cannot produce that email, you will be asked to go home. During your time with us, the best rule we ask for you to follow is to do not record, take pictures, voice record, or do anything on social media that will violate the HIPAA Patient Privacy Act. So if you're found in violation of this, there are criminal and civil penalties along with immediate termination of your observation. If you're found to take pictures, video recordings of patients, of our providers, and or any of our agency information, your observation will be terminated immediately. So please make sure that you are following this guideline. So because of COVID-19, there are a few things that changed within our agency. I've told you guys about that PPE kit. EMT or paramedic, follow their guidance. If they're wearing it, you should wear it. Meaning if they feel it is necessary to don additional PPE, we ask for you to don it as well to protect yourself while you're here with us. We don't want you bringing home anything that you did not come in with. So please just follow the guidance of your crews. Also, if you have a confirmed COVID-19 positive patient and or a patient that is receiving a nebulized medication, we're going to ask for you to ride up front with the driver to the hospital. Reason for this is we want to limit the number of people that are exposed to these droplets, as well as decrease the amount of time that people are exposed to these droplets in this virus. So your safety is our number one priority. In the event that the scene becomes unsafe, you may be assigned to a specific location to ensure your safety. Follow the direction of your paramedic and EMT. We want to make sure that you stay safe while you're here with us during your observation. Also, in the event that there's a mass casualty incident, you may be assigned to a law enforcement officer or EMS administrator. A mass casualty incident could be a airplane crash or a mass shooting, anything that has a lot of patients that will need rapid transport very quickly. That is called an MCI, and we're going to need as much room as possible in the back of our units. So if that happens, you may be reassigned to someone to return you to your car so that they were able to keep you safe as well as have the maximum amount of space to transport patients in. There are a few things that result in automatic termination of your observation. Of course, the positive COVID-19 rapid test, you are able to reschedule your observation once you test negative. If you arrive late after your stated arrival time to your observation, you can expect your observation to be terminated immediately. You can then call me and we can get it rescheduled. Also, failure to adhere to any ride observer rules or any directions given by your EMS crew, failure to listen or to adhere to any of those directions or rules will result in a termination of your observation. After your observation, and if you have any unused PPE, so any gowns, along with that observer vest, return that to your EMS crew. Also, if you're interested in scheduling another observation with us, feel free to contact me and I can get you scheduled for that. Any schedule changes that come up, any questions, or any concerns that you have, this is my contact information. All of you have my email address. Feel free to call or email me with any questions, concerns, or schedule changes, and I will definitely take care of those. Thank you for listening today. I hope you enjoy your experience here with Guilford County EMS, and I hope to see you guys soon.